Hi, it's the nursing professor here again. Here we are for another Friday and fundamentals on Friday. So today our topic is to talk about hygiene. And with hygiene, we're talking about how we actually take care of the skin and personal hygiene of our patients. Skin is the largest organ in our body. And so you can only imagine how important it is to make sure that it is clean and as, bacteria free as humanly possible. So number one on our list is to talk about ADLs. ADLs are activities of daily living. And by that, we mean all of the grooming things we do, our brushing our hair, our bathing, our brushing our teeth, our putting on lotion on our bodies, all of those types of things. And we do it every day. But frequently when our patients are ill, then we do have to assist with grooming. Why is this important? It's for personal comfort. For one, just think about whenever you've ever been sick for a couple of days and you finally get enough energy to take a shower. It's like heaven. You'll feel so much better once you actually get that shower in. And so we want the same for our patient. It helps improve their self-image. It helps minimize or decrease infections. And so it's super important to actually the care that they are required to get when they're in the hospital. Now, when we're actually doing this, we want to make sure we're cleaning cleanest areas to dirtiest, because you never want to take a dirty washcloth and then put it on a clean area. It just doesn't make good sense, right? So if you have one washcloth, you want to turn it so that the dirtiest part is not going back onto the skin. So for example, washcloth, you're wiping your eye, you're going inner to outer, and then you would just turn that washcloth a little bit and you're able to do the other eye. That's really going to help with the possible spread of infection, because somebody has conjunctivitis over here. Frequently they end up with it in both eyes, and that's something we want to avoid. The other thing is to be aware of if we need to clean a perineal area. When we're talking about perineal, we're talking about a person's private parts. You wouldn't want to use a washcloth on somebody's bottom and then take that same washcloth and go to their face. Just doesn't make good sense. So we want to be aware of that. So there's several different types of baths that we can help. A complete bath, and that's when we're going to help our patient from head to toe, because they might have mobility problems. They're just too weak and they need help all over. All right. We could do a partial bath. A partial bath is when we actually do face, hands, armpits, and perineal area. Okay. So kind of touching up those places that are a must for someone to have. All right. Morning care includes face, hands, and helping a person brush their teeth. And usually we try to do that before breakfast, because that's typically how we take care of ourselves. So this is not like rocket science, but many times we make it that way when we're actually taking care of our patients. When we're cleaning teeth, we allow them to brush their teeth if they can. If they can't, then we put toothbrush on that toothbrush on the toothpaste on the toothbrush, and then we actually brush the teeth for them. If they're unconscious, we want to make sure they're turned to their side with their head slightly down, so that when we're actually cleaning the mouth, then excess saliva can actually run out, and excess water, and we might have a suctioning device there as well, because the last thing we would want is for that person to aspirate where that drainage is going down into their lungs. With dentures, it's very important that we have a towel in the sink, and frequently that is a question. What is a must with cleaning dentures is that there's a towel in the sink, and then we brush the dentures, making sure we're getting up into that gum line as well. The reason behind that is if those dentures drop, then we don't want them to break. All right. And so using the nursing process, think back to ADPI. We first want to assess. We want to assess what our patients can do. Whatever they can do for themselves, we're going to allow them to do, and we're only going to help where we actually need it. In our assessment, we're also going to do an inspection to make sure that there's no open areas or bruised areas or any of those things that may need to be addressed. We're going to make sure we provide privacy. All right. And we're going to assess the developmental level, because how we take care of a small kid would not be the way we take care of an adult. All right. And so we're going to adjust ourselves based on that. Nursing diagnosis would include anything from alteration in skin integrity to hygiene is even a nursing diagnosis, like alteration in hygiene, that this person's unable to care for themselves, body image, self-care image. All of those types of things could be possible nursing diagnosis. Then we come up with a plan, and without plan, we're going to make sure we have all our supplies before we go into that person's room, because there's no in and out. No in and out, going to get a towel. Oops, I forgot a washcloth, all of that. Get all of your supplies at one time. Agree with the patient that this is the time that we're actually going to get this bath done, and just go ahead and get it done. I would encourage you that if you're working with a nursing assistant or patient care tech, that you do the bath with them, because that will give you real opportunity that you can do an assessment. You cannot assess people's skin up underneath their clothing. And so it would be an ideal time to do a physical assessment with helping out with the bath. All right. Then our interventions are any of those actions. So those actions would be all the things we do to help that person get bathed. And so we want to make sure that we're documenting that, because we may find the person who we thought was a complete bath is really a partial bath. And then, of course, we're going to evaluate. We're going to evaluate whether or not this person was able to tolerate it, where they did need help. And we're going to make sure we document that so that that can be carried on throughout the admission of the patient. Of course, our goal is that we're going to get our patient as close to possible as to what they were prior to getting ill. So I hope that helps. Like, share. Any nurse, nursing assistant, patient care tech, all of us could actually use this. And I'm going to follow up with a couple of questions for you, and I'll see you next video. Bye for now.